This tutorial presents an overview of the Problems, Allergies, Medications, and Immunization tabs in the CurrentCare Portal. Please note that all screenshots in this training show test patients with no actual PHI. Let's begin with a quick overview of the menu tabs for Problems, Allergies, Meds, and Immunizations. For the purpose of our training materials, we refer to these four areas of data as PAMI. In this screenshot, the Clinical Data menu on the left has three subtabs for Allergies, Problems, and Immunizations, while Medications is in a separate section on the left called Medication Management. PAMI details are pulled from Summary of Care documents called CCDs only if these details are provided using standardized formats such as ICD-10 for Problems. If you cannot find an item on the individual PAMI tabs, you might find it within these summary documents. Summary of Care documents are summarized by encounter and can be found under the Clinical Data Structured Documents tab. For example, if a medication was entered into an electronic health record as free text or another non-standardized format, it will be displayed in the structured document but will not be found on the Medications tab. The PDMP and Immunizations tab include the Download PDF button to download or print a report. However, the Problems, Meds, and Allergies tabs do not have a download button available. Instead, we've listed a couple of workarounds as described on the screen here. You could take a screenshot and paste it into another application, or you could try using the keystrokes Control plus the letter P to print to a PDF. The Problems tab is located under Clinical Data. This is where you will find any problems and codes sent by data sources that share CCDs. In order to simplify the view for you, CurrentCare will deduplicate the rows and only display the most recent time the problem was received. By default, it is sorted to show problems with the most recent problem at the top under Last Reported Date. The column on the far right shows the source that last reported the problem. You can also see the first date each problem was reported. You can sort any column by clicking on that column's heading. Here, we've sorted by problem description, which is shown highlighted in the left column. In the bottom right, you'll see the options if there are multiple pages of problems. You can use the arrows to move between pages, and you can choose to display a different number of rows on each page. The Allergies tab is also found under Clinical Data. Here you will find any allergies that are sent by data sharing partners, as well as reactions and comments. Allergies that are listed can be used to help inform patient treatment. However, it's very important to note that CurrentCare might not contain all clinical information for a patient, so the absence of an allergy should not be used to assume the patient does not have that allergy. CurrentCare will deduplicate the allergies and only show each unique allergy one time. By default, the tab is sorted to show allergies with the most recent at the top under Last Reported Date. The column on the far right shows the source that reported the allergy. The Medication Management tab includes the Reported Medications tab and a separate PDMP tab. Under Reported Medications, you will find two tabs that display medications that have been included within CCDs. The default tab is All, or you can view just the last 90 days. In order to simplify the view, CurrentCare rolls up the rows for the same medication and displays the most recent time it was received. By default, these two tabs are sorted to show medications in alphabetical order by generic name. You can also see the start date, last reported date, and the provider who reported the medication, and you can sort any column by clicking on that column's heading. The definition sidebar can be opened to review the definition of key terms. For example, the last reported date is the most recent date the medication was received by CurrentCare from any provider. Click anywhere in the sidebar to minimize it again. Drop-down arrows next to a medication indicate that the row can be expanded to show that multiple instances exist for the same medication. The triangle symbol indicates that a change in dose or provider has occurred. Here are some examples of rows that have been expanded. Example 1 shows how 2 instances of the same medication are shown under one drop-down arrow with different last reported dates in the far right column. Example 2 shows that hovering over a triangle icon explains that a dose or a provider has changed. The PDMP tab is available only to those organizations who have worked with CurrentCare to set up this functionality. This includes completing the steps required by the Rhode Island State Prescription Drug Monitoring Program to view controlled substance dispensed data. The columns include medication, state, date filled, which is the default, date written, days supply, quantity dispensed, refills remaining, prescriber, pharmacy name, and payment method. Example 1 highlights that you can pin this tab to My Patient Summary if you'd like to access this information quickly. Example 2 shows that you can hover over the information icon to show the pharmacy address. This tab allows searching, filtering, and downloading to a PDF. And finally, we will review immunizations, which are also found under the Clinical Data tab. On the Immunizations tab, you will find vaccines that are either provider-administered or patient-reported. These are populated from the CCDs sent by CurrentCare data sharing partners. In the future, CurrentCare might complete a project to receive immunization data from RICARE, the Rhode Island Child and Adult Immunization Registry. The default sort order shows the most recently administered vaccine under administered date. The additional columns are vaccine name, administered location, last reported by, and last reported date. This tab also allows searching, filtering, and downloading to a PDF. If you need assistance or have questions about CurrentCare, you can learn more at the web pages listed here, or please contact our support team, who will be happy to assist you.